Hi, my name is Karen Dubin, and I am a social worker and the Chief Operating Officer for Sweet Institute. And I'm here to start a conversation. We're going to be having this conversation every Wednesdays, where we're going to be talking about the transformation of mental health through social work. We are in a critical time, in a critical place, and social workers are in a pivotal role to be able to really take part in the transformation of mental health. And so we're going to start these conversations. I'm going to be here every week. I would love to hear your comments. You just put them below. Anything that you want to say about the topic that we're going to be talking about today. And today is going to be a little bit more of my own reflections on what it means in terms of transforming the role of social workers and transforming mental health and the transformation of mental health through social work, and some of the different experiences I've had in this process, and again, being able to hear your contributions, what comes up for you when we start talking about the idea of transforming mental health through social work, and all of the different things that have happened over the course of your careers that has allowed you to push through, created a pause, or a gap in what the experience was. I think for me, and so, just to sort of take it to a personal level, there was some hesitancy, excuse me, and some disempowerment, right? When I first started thinking about or considering what it would be like for me to transform mental health. And that doesn't mean that there hasn't been things that I've been doing throughout my career that has had an impact on my clients on an individual level, an impact on organizations that I worked with, and an impact on larger systems of care that I interacted with. But the idea of taking that a step further into conversations about taking a different kind of role, and it not being something that I'm doing through the course of working with my clients, not only anyway, but on a grander scheme, on a grander scale of what it would actually look like to be a part of a intentional part of the transformation of mental health, rather than it being a byproduct of the work I do with people individually, or the work I do with people when, I work in an organization, or, when I'm working in a system of care around policy issues, but where it's about a particular issue, but not about the entire system of care, not about mental health overall. And so there was this feeling of nervousness, of fear, of doubt, and of the grand scale, and being able to do this in a much more intentional way, was a little nerve-wracking for me at first. And it also, staying in that position also doesn't serve the greater causes and the greater goods of what it means to be a social worker for me. We know things like the limited access that our clients have to systems of care, the limited level of integration people have in being able to get care in programs that, or in services that are going to address all of their needs or most of their needs, but instead there's such a fragmentation, and the ability for people to really recover gets lost in the process of this experience of kind of being shuffled around. That's been my experience as a social worker, and advocate for people who were living with behavioral health issues and involved in the justice system. So who gets services, who doesn't, stigma, the fragmented, siloed levels of care, still forgetting about the things that really have an impact on our overall mental health, like the needs of women, the needs of men in their 40s as well, around medical services, and how that also has an impact on our health, mental health, and our overall well-being. So all of this, coming together to a place where sitting back and hoping somebody else is going to do it doesn't work. So join me in the conversation of transforming mental health through social work, and I look forward to hearing your comments.